Good afternoon. Since March, my team and I have been sharing updates on the COVID-19 fight against this pandemic. It has been a long, challenging fight with many twists and turns, but at times we felt like the daily rise in new cases and unfortunately the number of COVID-19 related deaths would never slow down. After a few months, we settled into a daily stream of single-digit new cases, and we began to see a significant improvement over what had been facing us presently. From putting restrictions on businesses and beaches and houses of worship and travel, we took a number of solid steps to try to minimize the threat of the virus on our community. Some of those steps were very hard to accept, and they changed the way that we operated on a day-to-day basis. Eventually, we were able to ease most of our restrictions, but we still have a mask mandate requiring everyone in the community to wear a mask when they're inside of public places. Unfortunately, we're seeing a significant rise in new cases once again. This is not necessarily a surprise. For months, public health officials, including our own City of Gary Commissioner, Dr. Roland Walker, has warned that we would see daily increases in positive cases as the weather cooled and the flu season arrived. Their predictions have been proven true. In the last week alone, we have seen nearly daily double-digit increases in the number of new cases. I'm not to the point of returning us to the restrictions that we had on our travel, businesses, houses of worship, and our own personal travel, but if this trend continues, it is very likely that I will have to order the city to resume restrictions. For now, I want you to keep in mind that our mask mandate, which is supported by the City of Gary Common Council, and an ordinance, calls for fines for anyone who violates the mandate, and it will remain in place indefinitely. We will not allow trick-or-treating activities this year, but we are considering a harvest festival in place of the traditional Halloween activities. But that is also contingent upon how we deal with this COVID-19 virus and the increases that may occur. For now, I'll invite Dr. Walker to share more statistics with you and more relevant information. Thank you.
Well, thank you, Mayor, for this opportunity to speak to the citizens of Gary. Thank you, citizens of Gary, for allowing me into your homes, allowing me into your cell phones, so that we can talk about this pandemic as it affects us in 2020. I think first I'll go over the numbers, the recent numbers, so that we can understand where we stand as a city. In Indiana, as of yesterday, there were 2,328 new cases, which leads Indiana to have 143,495 total cases. And there were 22 new deaths, which means that now in Indiana we've had 3,654 deaths related to COVID. In Lake County, there's 201 new cases. So that takes our total to 12,528. There were 3 new deaths, so there's been 346 deaths in Lake County. Now, here's the numbers that I'm sure that everybody wants to pay close attention to, and that is we had an increase of 18 new cases in the city of Gary yesterday. So we now have 1,675 cases associated in Gary, Indiana. We've had 83 deaths and no new deaths as of yesterday. So first I want to thank Mr. Martin Brown, because he has helped us to tabulate numbers, to interpret numbers, and he helped develop our website and our dashboard to inform the citizens about COVID. And just to tell you a little something personal about him, he actually did that volunteering because there was no funding for him at first. This was not part of his job. He did that because he was doing it for the citizens of Gary until we could move forward and find some funding for him to do that. So we're very appreciative to Mr. Martin Brown. And I want to stress 2 things. One, our rolling average now, our rolling 7-day average is now 12. So what that means is that you want to know what the average is going to be on a daily basis, and we expected, and it did go down in the summer and it's going back up. Now we're expecting, a minimum of 12 cases a day, because over the last 7 days it's averaged 12 cases. I want to take a look at this website for a second and this dashboard, because what this is also going to show us is what the month of October looks like. And what's really, really, really important about this to look at is that October is on target to definitely be the second most cases since we've started, and it's a possibility that October could be the most populous time that we've had COVID cases. We've hit the mid-month mark, and we already have 159 cases for the month. And the more cases you have, it tends to exponentially increase. And so in the second half of the month, we'll have more cases. So this could potentially be the month we have the most cases. So I just wanted to make sure that before we begin our discussion that everybody had an idea of where we stand in terms of cases. Now, if you look at Gary compared to our surrounding communities, look at Gary compared to Indiana and other surrounding communities, yes, we have been very fortunate. We've done better than most communities, okay? Part of that is because we were the first to have a mask mandate. People have been compliant to that, and we've been very fortunate. But now you're going to start to see increases. And why are you going to see that? One, because it's fall. In fall, there's a lot of things about COVID we don't know, but there's a lot of things we do know about viruses, respiratory viruses. One of the things we do know is that as the days get shorter, there's less UV light. So because there's less UV light, viruses are able to live longer, and you have more viruses. Two, because it's fall and it's becoming cooler, people are more indoors and they congregate more. And so with more people congregating together, you're going to have increased spread of the virus. And so we also know that the holidays are coming, because obviously in the fall and the winter you have our winter holidays, and so these things are going to continue to occur. I do want to also thank our staff at the health department, which includes Veronica Collins, Brandy Downs, and Shirley Borm, who, when you call the health department, are able to give you advice about how to handle COVID, and as well as Rosemary Walker, who's the person who tabulates our numbers on a daily basis. So we're appreciative to them. And so those are the things we know. We know that Halloween is coming. Not only is it cooler outside, but we typically during this time of year, you have trick-or-treating, you have Halloween parties. We know that Thanksgiving is coming, where families come together. We know that Christmas is coming. So we had to take steps to try to mitigate our risk. One is that we've said that we're not going to have trick-or-treating this year. We feel as though trunk-or-treats or events that have social distancing, who don't have things that cause people to congregate and gather together, are our best option for this year. Next year we'll love to have some things, large parties where people can congregate together, but now I think it's best for our kids that we try to give them something for entertainment, and like in a trunk or treat, able to pass candy and have them move on and return to their homes. I also understand that people are fatigued, right? People are fatigued at this point. But I want to tell you about this virus. This virus doesn't care about holidays. This virus does not care that you're tired. This virus does not care that you want to party. This virus is going to continue to do the same things that it has always done, and that is infect people. And infection can be very, very, very dangerous, so we have to be cognizant of that. Not only can you be infected and people have acute problems and end up in the ICU, but lots of people like myself have long-term problems. As we informed people before, I had COVID and I was asymptomatic at the time, but then it affected me. Later on, I started having weeks out, months out, started having joint pain, started having high blood pressure. These are some of the effects that people can see with something they call long hauler syndrome. So we need to take this very seriously. There's a couple of pitchers in Major League Baseball that were unable to continue this season because they were having extreme fatigue and muscle pains and weren't able to play. And this is an outside sport, and this is not a consistent contact sport. So we know that within contact sports, even young people that play in major leagues or play in the NBA can be affected, or play in NFL. So I also want to, once again, stress that I don't think that it's appropriate to have contact sports, team contact sports at this time, because not only are you risking the youth to infection, but then those youth can bring that back home to mom, to grandma, to aunt and uncle. So we need to really, really be careful of that. So I want to make sure that everybody understands that we continue to have a mask mandate, and I'm very appreciative to our mayor for allowing us to have this mask mandate. We were a leader in that, and after we had our mask mandate, then the county followed, and then the state has followed. Also, I want to update you that our governor has extended the mask mandate for the state because recently our health commissioner for our state, Dr. Boxer, we wish well, tested positive. And so then the governor was tested, and his results came back yesterday and were negative. So what should we do going forward? You're going to want to have family events, right? And everybody understands that. So Thanksgiving is coming, Halloween is coming, Christmas is coming. The suggestions are simple, and they may not be what you like. One, we need to, if we're going to have in-person gatherings, you need to limit your numbers. Large gatherings that we're used to, those probably aren't appropriate for 2020, and hopefully we can do those again in 2021. You want to do things outside as much as possible. So if you can have an outside gathering of small numbers, that will help. You want to do things virtually. So if you want families to congregate together and then have virtual connections through whatever media you use, Zoom or so forth, that can be very helpful and it saves lives. If we're coming together, you want to remain 6 feet apart. We want to wear masks. We want to wash our hands. These things sound so simple, but these are the things that save lives. And I want to end on this note. So we know there's been some high-profile people that have contacted COVID lately and have proclaimed that they've been cured. That's debatable. People do recover with the proper treatment. Some do and some don't. But you are not going to get the same treatments as some of these high-profile people. Most of these treatments are not even available and FDA approved yet. So you really have to think about it. I know how fatigued we are. I know how tired we are. I'm tired. I want to go to the movies. I like concerts. But we need to protect ourselves, and most importantly, we need to protect the people around us by doing the common things that we can do. Washing our hands 6 feet apart, wearing a mask. Everybody in here today, I'm going to give everybody a mask. Also want to tell everybody that on today and tomorrow, and again on the 30th and 31st, so today from 1 o'clock to 5 o'clock p.m., tomorrow from 9 a.m. to noon, we're doing flu shots at 426 South Lake Street. Now, yesterday we did it at Railcat Stadium. Anthem is sponsoring. Anthem Health is sponsoring. CVS is delivering the shots. Edgewater Health and Walker Medical are partnering, and the health department, are partnering. So it's because we've already seen now our first case is a person in Mexico that's in the ICU right now who had both influenza and COVID. That's a really bad combination. So please get your flu shots. These flu shots are free. It's a drive-through. You don't have to get out your car. You can go right now. It's occurring right now, 426 South Lake Street in Gary, Indiana. It'll occur again tomorrow morning at 9 a.m. And then in 2 weeks, on the 30th and the 31st, it will occur again. You can get a free flu shot, and you will get a free cloth mask when you go. You don't have to leave your car, and you don't have to pay any money. And I appreciate your time. Thank you so much, Mayor. Thank you so much to the citizens of Gary. And we're all in this together. Thank you.
So we want to thank Dr. Walker once again. Just glad to have a professional, knowledgeable health commissioner who's willing to go the extra mile to share information with our residents. In conclusion, we all know that 2020 has been a very challenging year on many levels. One of the challenges that we faced is trying to get the most accurate possible count for all of our Gary residents in the 2020 census. As you know, the U.S. government conducts this count every 10 years, and your participation in this event has been critical to getting an accurate count of Gary's population, which in turn affects the amount of funding and assistance that we receive from the federal government. An accurate count would have meant that we would get more federal funding and resources from everything from education to disaster relief and very much more. Because the COVID pandemic has occurred, the U.S. Census became moved to October 31st. Recently, the U.S. Supreme Court ordered just yesterday that it be shut down on the 15th of October. The complete census count was a way for us to have our voices heard and to make sure that we receive every dollar that we were entitled to. Now I urge you to exercise your vote voice rather in another way, and that's through your vote. You can do it in person or by mail. Whatever method you choose, the most important step that you take is having a voice and making sure that your voice counts for the city of Gary. So whatever you do, make sure that you get your ballot cast ASAP. I can't tell you how important this is to the city of Gary, but I will continue to stress that our vote is our voice. As I've said from the beginning of the COVID-19 public health crisis, we have been waging a war against the virus, and it's been unpredictable and it's been difficult. But I'm proud of the way that we have fought this challenge, and we will continue to fight the challenge as a city and as an administration. And as I've often said many times before, if we remain calm and we remain patient, we will get through this together. Thank you.